A new study out of Michigan finds that as many as 46% of parents say their teens have shown new or worsening mental health symptoms during the COVID pandemic. Researchers believe it's because of a decrease in socialization. We're joined by Dr. Lynn Dell, the medical director at Children's Hospital's Behavioral Health Center, to look into this issue. Dr. Dell, good morning. What are you finding at Children's?
Good morning. We are seeing a lot of effects, influences of the COVID-19 pandemic superimposed on what we typically see with adolescent depression, anxiety, and coping with the stresses of regular adolescent life.
So this group Fair Health tracked data about actual claims throughout most of the last year, and they found that mental health claims, I wouldn't have to bore people with the numbers, but they shot up dramatically, and that's sort of what you're seeing also, is that just as a percentage of claims and what children are going to the hospital for?
Oh, definitely. And it's across the full continuum of care. My colleagues in general pediatrics are seeing increases in the overlay of anxiety, depression, eating disorders even in their outpatient practices, all the way through outpatient psychiatry, increase in emergency room visits, and increases in COVID-related stressors that come up all the time for kids who are presenting and requiring inpatient psychiatric hospitalization.
You know, this is a stressful time for everybody, whether they have a business that's affected or a job, maybe mom or dad, or mom and dad were out of work. So that's one level of stress in the household. But how much does socialization, just for a time there, an inability to interact with others your age, play into this?
It has a very large role in this. If you think about normal development, even when things are going well, and when a parent, a family, a guardian is able to optimize the situations, home life, school, socializations with kids, the role of friends, of activities, teams, religious organizations, that's how kids learn how to identify themselves. It's a big part of development, and all of that has been disrupted with COVID.
So what do you most want parents at home, or even the teenagers themselves, to know? What should people know about this?
Number one, talk about it. This is okay to talk about. Missing school, missing friends, the changes, lack of supervision, parents not being able, feeling powerless or struggling to provide what they optimally would for their kids. So adults talk to other adults. Adults talk to your children. Kids, bring it up with your parents, and there's nothing too small to talk about. There's nothing too small, no too small observations that, nothing is too small or insignificant to reach out to your pediatrician, to teachers, to clergy, to all the numbers available for psychiatry, to our department here at Chinola.
All right, Dr. Lynn Dell from Children's Hospital, probably very good advice. We appreciate your sharing that with us this morning.
Thanks for having me.